Welcome to Body Conscious Pilates. My name is Allison, and thank you for joining me for a few videos on post-operative recovery. So I just had pelvic laparoscopy as well as hysteroscopy, and so I am on the first day after that recovering, and I wanted to start out with some tips for how to catch your breath and how to support yourself if you need to cough or clear your throat. So for those of us who have had abdominal or pelvic surgery, any of that flexing at the spine where you hunch over, extension of the spine where you extend back, just isn't comfortable stretching or working those abdominals. But those abdominals also play a part in our breathing, our coughing, and clearing our throat. They help create that pressure to be able to do those things. Your throat might be irritated after surgery and you might feel the need to cough or clear your throat. And of course, we all want to catch a nice deep breath every now and then. So I'm going to show you some ways to position your body when you just don't feel like you can get that cough expelled or get that breath full when you're sinking down into your pain. So I'm going to demonstrate this sitting. One thing that I have found that helps me catch my breath if I want to take a nice full breath is to lean a flat torso forward or lean a flat torso back. And I'm going to show you that face on to the camera. So I'm sitting in a chair, I put my hands on my knees, and I lean into my palms with a mostly flat or neutral position back, and then breathe in. All the while I'm doing this, I'm really supporting myself with my hands. What that allows is for the hands to take over the role of the abdominals or perhaps the spinal erectors. And those muscles that are not ready to come to work yet can be helped out by your arms on the outside of your torso. And so you're using your arms to give your rib cage space to expand down and out, and then collapse back in without overtaxing the abdominal area. Sometimes I found it helpful to lean back in a chair, or if I'm in bed, lean back in bed, again, with that mostly flat or neutral spine in the torso. So that means that I'm leaning back with a flat approach to the lean and a hinge from the hips. I'm going to show you that face on. So I might put my hands behind me in what space I have in my chair or on the couch and lean back and take a full breath. And what that does, again, is the support of the hands allows the chest to rise fully in front of you without the abs gripping as you try to get a little more space in that whole trunk area for you to fully expand with the breath. Now, to cough or clear your throat, I found this most helpful, again, in this leaned over position where I have a mostly neutral spine, hands supporting me, hinging at the hips, and then I could cough, again, with my hands providing the support that might usually come from the abs. And then it becomes more of a chest expulsion. And again, you're not working that area that's probably had some incisions and where some of the surgical work has been done. To clear your throat, similarly, lean forward. Now, I am having to use abdominals there to create that pressure to help clear my throat. But now I have some support, again, from the strength of my forearms and shoulders to help me get that done more comfortably. So to help catch your breath, cough, or clear your throat, use the strength of your hands to put your neutral spine into a forward or a pitched back position, again using the strength of your hands, to get some support to allow that chest to rise and fall, and also some support while you create that intra-abdominal pressure for a cough or clearing your throat. So I hope that helps you on your road to recovery. Thank you for joining me.